had a number of different questions about pain, painkillers, and that kind of thing. Do you want them all lumped into one?
Yeah.
Okay.
Yeah.
So we've got people with bone pain, joint pain. So they're on, for example, Adcal for osteoporosis. We've got people who have gluteal tendinopathy, who tend to take Codipar for pain. And then there's people asking about your Tylenols or your paracetamols versus ibuprofens and all of that kind of thing. So can you talk us through kind of a little bit about pain and analgesia and that kind of thing, please?
Yeah, okay. So there are four groups of painkillers in general, okay? And they all work in slightly different ways. So you've got your paracetamol type, which reduce the transmission of pain signals, in the originating tissue, okay? You've then got opiates, which are codeine, tramadol, morphine, heroin. And those affect the way the brain perceives pain. So they don't affect the signal originally, they affect the way the brain senses it, okay? The third group are the brufens, if you like. They're not actually painkillers, they are anti-inflammatories. So most pain is associated with inflammation, and so they affect the inflammation, reduce that, and therefore reduce the irritation of the pain sensors. And then you've got the group called things like gabapentin and tricyclic antidepressants and the things like that. So these are in a sense nerve controllers. So they control transmission of pain sensations in the tissues through the brain. So in sequence, it is Brufen works first, reducing the irritation of the sensors. Paracetamol works second by reducing the sensors firing. Gabapentin works third by amitriptyline is another one. So they reduce the transmission of the nerve fibers, and then you've got opiates which reduce the sensation in the brain. Okay, so you've got four levels of painkillers. Now, all of those are basically okay in PBC with a little bit of a caveat. So paracetamol, people worry about because of liver injury with paracetamol, but we only see that in overdose, but you don't have to take a massive overdose to get paracetamol-induced injury. So when you talk about a paracetamol overdose, most of those are people trying to harm themselves, but about 10% of all paracetamol overdoses that end up in hospital are people who didn't realize they'd taken too much, okay? And if you've got very active liver disease, you can't take quite as much as an ordinary person can because your liver can be a bit sensitive. So sorry.
When you say active liver disease, does that mean highly abnormal liver biochemistry, or does that mean a lot of cell change?
I was going to come to that exact point.
Sorry, mate.
So for the average PBC patient with normal tests on URSO, you can take a full dose, right? I would be cautious if you have any elevation of bilirubin or you have any suggestion of scarring or cirrhosis, okay? And in those situations, you're still fine taking paracetamol, but take no more than half the dose, okay? So 1 tablet 4 times a day versus 2 tablets 4 times a day, right? So I would use jaundice and cirrhosis as the caveat. So most people are fine as a bottom line. Now, just remember that, if you some drugs we adjust the dose according to body size, but we don't with paracetamol. So if you're a 6-stone lady, then in a sense the full dose is already a little bit much. My wife is tiny, and she only takes half a dose of paracetamol for that reason. So a bit of common sense there. What about Brufen? People keep telling me you can't take Brufen in PBC. I don't know where that comes from, but you're absolutely fine to take Brufen in PBC. There is no interaction at all. Remember, it can cause stomach irritation, so you can get gastric pains or even bleeding. So if you do get that, be very cautious with it. Go for something else, but Brufen is absolutely fine. It works better for pain control given regularly as a preventative than to treat the pain. So if you know that you're going to have arthritis pains, later in the day, take it in the morning every morning and stop that from happening rather than waiting for it to develop. Gabapentin, as many people on the call will know, we actually use to control itch in PBC. It's a really quite effective itch treatment, which tells you it's safe in PBC. The reason we use it for itch is that pain sensations and itch sensations are actually, in terms of the body's process, very similar. Okay, so gabapentin is fine if your doctor suggests that. We use it for a lot of nerve type pain, so nerve trap pain is a classic example, and it works very well. Just be slightly careful. It can sedate people, okay? So if you're getting brain fog, it might get a little bit worse with that. And the way to get around that is to just start with a very low dose and build it up, or to split the dose, during the course of the day. But don't take a big dose as a one-off, because you may end up zonked, okay? And then opiates. I would, if at all possible, avoid opiates in PBC, because there are other ways to control pain that are better, okay? It's a kind of last resort type of thing, but it also does two things. Opiates do two things. One is they also zonk you, and liver disease and opiates don't go well together because your body isn't as good at clearing them, and so you're much more likely to get sedated. And the other is they cause itch, okay? And we know this because we use a blocker of opiates called naltrexone as an itch treatment. So in general, I would want to try and avoid opiates of any type if I possibly can, because there are probably better ways of controlling the pain, and actually they can have downsides. And remember that not all opiates kind of have that name. So was it Copar?
Copar, yeah.
Yeah. So Copar is a combination. It's not a UK one, but it's a combination of codeine, which is an opiate, with paracetamol. And one of the dangers with a number of these types of medicines is that you sometimes don't realize that what you're taking, okay? And there was a spate in the UK about 20 years ago of inadvertent paracetamol overdoses. So people coming into hospital with liver failure who'd taken an overdose of paracetamol, but they hadn't intended to hurt themselves. And it was because they were taking night nurse and cocodamol and paracetamol, and the labeling of packets didn't make it absolutely clear that they all contain paracetamol. And we actually we looked at all of the compound combination, treatments for pain and, flu-like symptoms on the market, and 80% of them had paracetamol. And yet they didn't clearly say this contains paracetamol. And so it was the cause of all of that. And we ended up getting that changed. So just watch out that's there. So Copar sounds like nothing like codeine and paracetamol, but it contains both of them. Now, that's fine if you want to take both of them. But if you don't want to take both of them, you want to avoid it. And I would tend to avoid things like that.
Perfect.
None of them make PBC worse, in case people are worried about that.